Let's look at exactly what they say. Dilemmas in diagnosis and case management. Moreover, factors such as premorbid personality and a tendency to somatization may determine the length of convalescence and the response to post-infection fatigue and joint aches. Even if the original diagnosis of Lyme disease is undisputed, lingering or current symptoms, many of which are also characteristic of chronic fatigue syndrome or fibromyalgia, may not be attributable to persistent infection. Here, Barbour and Fish clearly attribute chronic neuro-Lyme, post-sepsis Lyme, post-Lymerix Lyme to a psychiatric illness. CFIDs and fibromyalgia at that time were considered mental illnesses. This was because they later in this article admit the OspA vaccine trials were underway, and they knew the OspA vaccines were causing the same post-sepsis outcome. So you absolutely have to have this article to prove to the Justice Department that these guys knew the vaccine was causing a disease that they later threw out of the Dearborn case definition, the chronic neurologic Lyme, and that they were trashing us. That's part of the racketeering charge. Look closely. Start at the bottom. Phase 1 human trials of a recombinant OspA lipoprotein have begun. There's a period after that sentence. That was 1993. So let's look again. Prevention through immunization. Until disease pathogenesis and immunity are better understood, the risk of provoking disease through vaccination cannot be accurately predicted. Well, I guess they knew. Because Lyme disease is rarely fatal, societal tolerance of untoward reactions from the vaccine would probably be low. We already knew these guys were lying assholes, and so when we looked at their data, we figured it out that this was what the scam was all about. Some patients with Lyme disease involving the joints or nervous system do not improve substantially even after parenteral or IV antibiotic therapy. Although doubts remain about many diagnoses of chronic Lyme disease, the specter of a large number of persons with unrelieved disabilities prompts further consideration of a BB vaccine for high-risk populations, such as outdoor workers and residents of endemic areas. I thought you said they were psychiatric, Alan. In any event, here they're admitting the phase 1 trials of OspA were underway in 93. They're also admitting that the reason they're having a vaccine in the first place is because of the result of chronic sepsis Lyme, causing long-term disability with neuro symptoms, which is just like chronic fatigue syndrome or just like post-sepsis syndrome, which is the same thing. So here they are admitting all of it. And if you are interested in helping us get this case prosecuted, you must have this document and share it around to show that this is what they were doing. They knew the vaccine caused problems. They knew the vaccine caused a disease like chronic Lyme. And then they went ahead and falsified the case definition and threw all those patients out and said, you can only have Lyme disease if it's a bad knee and no other symptoms.